Hello, I'm Logan Phillips and welcome to my vlog, or as we like to call it, the VLOGAN. This is a vlog dedicated to people with special needs and those who love them. Thank you for joining me. We're here at Boundless Health today, and I am lucky enough to be sitting here with Anna Wuerth, the Executive Director of Boundless Health, Dr. Cindy Ripsin here at Boundless Health, and Samantha Blanchard, the Outreach Manager for I Am Boundless. I'm so excited to be here today because Boundless Health is kind of brand new and I think really fits a need of the community. So tell us about Boundless Health, why Boundless Health and why now?
Boundless Health stemmed from I Am Boundless, which is a little bit more established in the central Ohio and actually broader Ohio region. And we identified as an organization that there were unmet needs of the clients that we serve, and that healthcare, that whole person approach to health was a gap that existed in our community. So I Am Boundless created the sister organization, Boundless Health, to achieve that mission of offering primary care. Soon we'll be offering dental, and we'll be adding on pharmacy to be able to offer very comprehensive services alongside our existing behavioral health, psychiatry, speech and language, and other kind of care coordination services that we're providing in the community.
What is I Am Boundless for those folks who don't know what I Am Boundless is?
I Am Boundless has been around for, I believe, 40 years or more. A lot of people who have been in the area probably knew of Franklin County Residential Services, and that's one of the agencies that made up I Am Boundless. Services that we provide stem from in-home care, such as the Parent Direct program. We have a lot of people that take part in that all over the state of Ohio. We also have residential services, so this would be supported living services in the community. Our other agency that made up I Am Boundless is Step by Step, and so that would be those behavioral health and center-based services that you would receive here on the Worthington campus.
So I Am Boundless is an organization that helps people with special needs, whether that's helping parents to support their child, getting behavioral supports, school, and then they found the need in the special needs community for health care. That was something that wasn't being met, and so then Boundless Health was formed. And Dr. Ripsin, can you tell us what you do here at Boundless Health?
Sure. I've got a dual role of being the medical director, and then I also see patients as well. So primary care, I'm a family doctor by profession, so I see patients from infants all through the final stages of life, and then I also direct the mission and the goals of the health center itself.
So how many doctors are here on staff, and do they have specialties?
So far within primary care, it's just me. We're in the recruiting phase right now. The sort of the grander plan is to have around 5 providers for the primary care. We're moving from this smaller building into the larger building here probably in the next half year or so, and we expect to grow into that building pretty quickly. Now, you asked about doctors. We also have Dr. Ramanoff. She's a psychiatrist. She's a specialist, right? Psychiatry is a specialty. She's actually here in this building as well, part of Boundless Health. But in terms of primary care, right now I'm the primary provider.
What's primary care mean?
Think of the primary health care not only to take care of you when you're sick, but also to help you stay well. Kind of anticipatory guidance for parents when children are little, typical vaccines, and then all kinds of preventive type care as you begin to age. And then also to manage acute care as well. So we manage the acute care needs for our patients, cough, cold, sprained ankles, I don't feel well, but also all the preventive care as well.
If a person wants to learn more about Boundless Health, or they say, hey, maybe Boundless Health is right for me, where would they go to find that out? And then a follow-up question, is this just for individuals with special needs?
That's a really good question. We open it up broadly to anyone, and we do that primarily because we want to normalize the experience for people with special needs and encourage their families to be part of care as well. But also we sit in a community and people may want to have their health care right near them. So we do have folks from the community without any special needs at all.
So Anna, if I'm hearing that correctly, a family that happens to have a child with special needs, the whole family could come here and Dr. Ripsin could be the family doctor.
That's right. Dr. Ripsin can provide care to the whole family. We offer a sliding fee scale. So for a family who may be on a lower income level, we're able to work with them to adjust their payment and make it a little bit more accessible to them. Of course, we accept Medicaid and most commercial insurances as well.
So how are people learning about Boundless Health?
We recently got a new website, and they can also call in and they can get a tour scheduled and kind of get to see what things look like here before they bring their child with special needs or their individual with special needs, so that they're familiar with that. Service coordinators in Franklin County, they also have the information too. We met with them this week, so that information's out there in the community now.
If one of the people who are watching this have a child with special needs who does not like crowds, loud noises, and needs a different experience than waiting in a waiting room where the door's opening and all of that, do you all have something that can help that child?
Yeah, we've got a couple of things. That's a really good question. Part of the experience that some of these people and families experience out in the community when they try to get their health care. It's not that there are bad doctors in the community who don't want to care for these folks, but some of these folks have really special needs as they're coming and going. So we have a quiet area in our waiting room, and if someone needs to use it, they can go right in that area, close the door, and it's nice and quiet, and you can bring the lights down.
Do you all do something unique related to appointments so that you always have this room available for someone who might need it?
Well, if this room isn't available, we've got other ones that are quiet as well, and we'll show you those in the back. But we do space our appointments a little bit differently than typical primary care. We allow an hour for the first visit. That gives us plenty of time to interact with the patients and families. And then as people are coming back, it just kind of depends on their special needs if we go to a 30-minute or a 15-minute appointment. But we always make sure that we have enough time to actually spend face-to-face with the patient.
So so the appointments are built around the patient
Yes.
rather than the doctor's schedule.
That's exactly right. Also, if we need a little bit more of that in the medical area ourselves, we call them consultation rooms, but they're like exam rooms without exam tables, just because they look and feel a little bit more comfortable. And so we begin to identify the patients in our practice that need that a little bit extra quiet. And so when they come in, we're aware that they're going to need that extra quiet. So they go right from the check-in all the way back to medical, and they just sit quietly with their parents until we're ready to see them. So this is just a typical consult room. And where this is nice is, if you notice, the lighting here is much lower. And so when we have people come into the waiting room and that quiet room is busy, or people need more quiet than what we're able to give them out in the lobby, we bring them in here, and it's really nice and quiet in here, even when it's really active out there. So we've got a couple here in this building for this, and when we get into the new building, we'll have several that look like this.
Amazing. So Anna, is that something that a parent could tell the staff when they're scheduling, hey, I have a child who needs to be put into his or her own room at the beginning?
Yeah, absolutely. When we're scheduling appointments, either with the front desk or our intake team, parent or whomever is scheduling the appointment can let us know if there are any kinds of special needs or accommodations that we can put in place to make that appointment successful. Our team will document comments in the scheduling system, and we're able to review those comments prior to the visit and help streamline that. So we're getting folks checked in quickly and notifying Dr. Ripsin or the nurses if there are any additional steps we can be taking to make sure that it's a successful appointment. Some of the other strategies that Dr. Ripsin uses in her appointments is she'll take plenty of time with patients and their families, especially that new patient visit. That first time that they're in, we'll give plenty of time for Dr. Ripsin to meet with the family, discuss any concerns that they have. We try to keep it slow and calm, and we kind of go with the flow. And if we need to pause the appointment or have the patient come on back another time, we're happy to be flexible in that way.
So patients come in, they can sit wherever it is that they're comfortable. One of the nice features of this clinic are these exam tables here, right? So this is actually a full exam table. It goes all the way down, as low as it needs to, and then it can come all the way up, as high as we need it. And we do full pelvic examinations for females as well, and all of these exam tables will allow us to do that. And they also function as a regular exam table. This goes down, and this comes out.
Oh, wow.
Yeah, and if necessary for a female exam, we have our steps as well. But it's so much easier for people to access this, especially because it goes down so low to the ground. So folks in wheelchairs or people who are using walkers or have little vision, it's much easier for them to get on and off a table that looks like this.
Yeah. The blue pad that I see with handles on it.
Have you ever heard of the word called Ukeru?
No.
Have you ever heard of that? So some of our people, have problems with self-injury and injury to other people. Ukeru is a way for us to manage that without having to use restraints. But it's a way that we help manage people to bring their aggression down without actually having to hold them. Those pads help us do that. Yeah,
Great.
Yeah.
Thank you.
We're all trained in that. Everybody in Boundless is trained in that technique. Holly Franny is our Director of Nursing.
Hi, nice to
This
meet
is
you.
our
Hi, Holly.
nursing area here. We have our Director of Nursing, we have an LPN, and we have medical assistants that help us manage our patients.
Wonderful. Thank you. Are there special attributes that a doctor who's going to work with a community of individuals with special needs need to have?
Well, within our clinic, we certainly want people to know how to do broad spectrum primary care. So we will always hire board certified people, but that kind of gives a base of knowledge for primary care. And then there's a comfort level for people with special needs. Probably every condition we see, there are a few special screening things that we need to be doing. So, for example, people with autism, very, very common to have constipation. So it's really important that we don't forget to ask about that at every visit. Okay, people with Down syndrome, it's really, really common for them to have problems with laxity in the cervical area of their spine. And so it's really important that we do screening tests, not necessarily x-rays, but screening tests and examinations every time we see the individual with Down syndrome. So and there's lots more of those. So you need to have that. We can pick that up pretty quickly as board certified physicians. So the main thing is to be comfortable with the population, to understand that we are really treating an entire family when people come, and to know that that is our mission, is that the patient's at the center of the care that we provide. And this is our lab. So we can do pretty much everything from pap tests to lab tests to urine tests, everything pretty much right here, and even COVID tests we do.
Whenever a client works with me, they do what's called a roadmap for their child. And that roadmap is kind of a place where they can put down, here's where my child is, and here's where we hope that she's going to go. Lots of my clients talk about blood draws being something that gives their child with autism tremendous anxiety. Do you have a special kind of technique that you use to help bring down that anxiety level when it comes to blood draws?
And we may have an agenda when someone comes in, and it might be blood work, but the patient and the family is involved in that as well. So if we need blood work and someone's anxious about it, we have the decision to make. Can we make them less anxious and give it a try? Or can we say, it looks like you're really anxious, how about tomorrow, or how about next week? That's the type of flexibility we want to give people, because that actually works really well. We've had, though, a number of people come in. Parents have told us he hates having his blood drawn, or we've never been able to get an EKG on him. When you take your time with people, explain kind of up front what's happening, a lot of times you can move through their anxiety.
Boundless Health knows that certain individuals in our community need that extra time, and it's not going to be on doctor schedules or nurses' lunch schedules. It's going to be on that individual schedule.
Yeah, it's really true. And it's not just the doctor, it's also the whole of the staff has that idea that everything is just calm when you're here. Nothing gets pushed through, and if something has to get rescheduled, then it's easy to do.
That's great.
Yeah, and I think that's part of the experience that people have. It's not that anybody intends poorly out in the community, but when you think about it, you're trying to stay on a schedule, you have so many people to draw, and you're not as comfortable with the population. Everybody's anxiety is very high, and people, whether you have autism or not, you're gonna sense that. So when that anxiety is high, that's gonna make you more anxious.
You mentioned at the beginning about the growth that you're expecting. You do offer some dental that's going to be launching here soon, but that's going to grow here in the very near future. Is that right?
Yeah, that's right. So we have big plans to move into a new facility on our existing campus. We're located over at 445 East Dublin Granville Road, and we're just going to be moving a little bit further down the street into a larger space that will accommodate all of our services. So our dental program in particular is exciting. We, at our current facility, we have one dental operatory planned. And when we move into our new facility at the end of the summer, we'll have a 6 dental operatory facility with a dedicated x-ray space and all new equipment installed. So it will really be beautiful space and allow us to accommodate lots of patients.
So Sam, as the outreach manager, what do you want people to know about Boundless Health if they're learning about it for the first time here today?
The most important thing that I like to tell people is there's definitely been a need in the community for care that specializes in taking care of individuals with autism and individuals with Down syndrome and those people that often are lost in the shuffle with the general practitioners in the community. And I think that knowing that Boundless has this reputation of taking care of those individuals, they should rest assured that that's going to happen here, that they're going to be heard, that we're going to know what we need to take care of when they come to visit us, and they're not going to be lost in the shuffle.
Well, thank you. Thank all three of you. I can tell that from the passion that you guys have for this, that Boundless Health is going to be like just about everything that I Am Boundless has done, which is a huge success and just a real treasure in the community for individuals with special needs. So thanks for being here. I hope you enjoyed this episode of Logan. Please like, share, and subscribe to the RRPG channel so you can stay up to date with some of the latest news in the disability community.